Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Weber syndrome. Weber syndrome is a lesion of the midbrain. Midbrain is a part of the brainstem. Brainstem has three components: midbrain, pons, and medulla oblongata. Lesions of the midbrain is caused by the following: occlusion of the posterior cerebral artery. There is a branch of the basilar. These are the branches of the basilar artery. Basilar artery is split into two posterior cerebral arteries. Aneurysm of the circle of Willis. Circle of Willis is formed by the posterior cerebral artery, anterior cerebral artery, anterior communicating artery, posterior communicating artery, and the middle cerebral artery. So anterior cerebral artery, middle cerebral artery are branches of the internal carotid artery. Posterior cerebral artery are branches of the basilar artery. We have two communicating arteries. So, is there any aneurysm? Specifically in the posterior part, we'll get midbrain lesion. Our midbrain will go through necrosis. Pineal tumor, pineal gland is a tumor. Pineal gland is a gland that is located just below the splenium of the corpus callosum. So, that tumor may cause midbrain lesion. Hydrocephalus, excessive accumulation of cerebrospinal fluid, may lead to compression on the midbrain. We have three syndromes associated with midbrain lesion: Weber syndrome, medial midbrain lesion. We'll go through this today. Benedict syndrome, paramedian midbrain lesion. Perinaud syndrome, dorsal midbrain lesion. Okay. So here Weber syndrome. So what is the site of lesion? So this is the site of lesion here, plus the oculomotor nerve. Okay. So this is a section of the midbrain. We have the basis pedunculi that composed of crus cerebri and the substantia nigra. Here we are seeing the red nucleus here. This is the cerebral aqueduct, periaqueductal gray matter. This is the superior colliculus level. Superior colliculus, this part is the tectum, and swelling here is the superior colliculus. So we will have lesion of the corticospinal fiber and the corticobulbar fiber and the oculomotor nerve. Okay, this will be affected because of lack of blood supply to this part from the branches of the posterior cerebral artery to the crus cerebri, specifically the area for the corticospinal fiber, corticobulbar fiber, and the oculomotor nerve. So this part will be damaged and will get the features of Weber syndrome. So this is a vascular lesion. Due to vascular lesion, there will be necrosis of the brain tissue and we'll get the syndrome. So what happened? What happened in Weber syndrome? Medial midbrain lesion result from occlusion of the midbrain branches of the midbrain branch means that mesencephalic branches of the posterior cerebral artery or from aneurysm of the circle of Willis, specifically the posterior part. Following structures are affected: oculomotor nerve roots, ipsilateral ophthalmoplegia. We know that the oculomotor nerve supplies a lot of extraocular muscles, so there will be ipsilateral ophthalmoplegia. Eyeball is deviated laterally because of paralysis of the medial rectus. In that condition, lateral rectus will pull the eyeball laterally. Pupil is fixed and dilated because the sphincter pupillae muscle will not work. It will be paralyzed due to oculomotor nerve lesion. So the dilated pupil will take upper hand and what will happen? The light reflex, people will not constrict. Accommodation reflex, people will not constrict, and it is fixed and dilated by the action of the dilated pupil, because sphincter pupil muscle doesn't work, plus the ciliary muscle, it will not work, so accommodation reflex is also lost. Upper eyelid droops because of paralysis of the levator palpebrae superioris muscle that is innervated by the oculomotor nerve. Corticobulbar tract involving the facial nerve, the vagus nerve, the 11th cranial nerve, and the 12th cranial nerve. There will be contralateral paralysis of the lower part of the face due to that. Neck, due to this, the accessory nerve. Tongue, that is by the cranial nerve number 12. Soft palate by the cranial nerve number 10. So we'll get contralateral loss of lower part of the face, neck, tongue, and soft palate. Corticospinal tract lesion will lead to contralateral paralysis of the arm and leg. Okay, so we got the lesion, oculomotor nerve lesion. We got the corticobulbar tract, corticospinal tract lesion, corticobulbar tract lesion. Okay, and that's all about the Weber syndrome. This is one of the midbrain lesion. In our next class, we'll go through other syndromes. Okay, so please share the information with your friends and please support my channel. If you have any question, please do not hesitate to ask me. Please subscribe me and have a nice day. Bye now.